Hi, we are going to talk about the setup for the manual vacuum aspiration or MVAs. We're using procedure room 2. The first thing I'd recommend is moving the leap and the colpo stuff out of the room. If it's not possible, that's okay, just leave it over here. You want to have the provider stool right here. The patient's partner is going to be able to sit right here, and the patient's obviously going to sit right here. When we start to do the procedure, for the specimen, it's going to be on a chuck in a bucket, and we'll decide what to do for there. So that needs to be kind of out of sight. So this actually won't be placed until we do the procedure. For the block, this is a non-sterile tray. It's just a clean setup. And what we've decided to do for this is to have an iodine with a urine cup. You can pour the iodine in the urine cup and have a couple of gauze sticks so we can apply that. Always have a sterile speculum available and a tenaculum. For the block, the provider, you can have the provider just draw up 10 mils of the lidocaine or whatever we're going to use for the anesthetic. We're going to do 20 mils, so it's better if you have 2 syringes and 2 needles. And then we're also going to be using this lidocaine slurry. And actually, this is a pre-filled syringe. It doesn't actually screw into this, so we're going to have to fill this into another 10 mil syringe. So we'll go ahead and just do that. For now, we're going to be screwing it onto the IUI catheter. Eventually, we should be getting new syringes that has a different kind of catheter because this one was a little bit too thin for the procedure, but that's what we'll be using for now. We're just going to have you guys just place one 4x4 gauze on here. So after we place the medication in the uterus and the onto the side of the cervix, we're just going to place a gauze up inside the vagina and take out the speculum. And then you can just kind of cover this and leave this sitting there. So that's going to be the clean tray. For the sterile tray for the procedure, we're going to actually be making sterile packs. That's going to go ahead, that's going to have a cup that we can place more iodine to clean again. It's going to actually have a speculum in it. It's going to have a tenaculum, a long ring forceps, and a curette. And it's all going to be in one big pack along with the dilator. So that'll be a pack. You can open it up. We're going to place a 4x4 pack of sponges here. This will be open to place some more iodine in there. And then you can you can just open it and throw on a pair of sterile gloves for the provider on here as well. And then you'll open up the manual vacuum aspiration, try to place it sterilely on the sterile tray. And then we'll also be using these cannulas, and we have them all separate. So you'll just have to ask the provider what size they want to use. Sometimes they'll just start out with one size and have you open another one. So that's going to be that. Hopefully we won't need to use the computer too much, but it is accessible to us right here. And then just make sure that the light source is in a good spot as well. We could also consider using the procedure light if that works better. And also I do recommend having some warm blankets for the patients to put over their lap, and definitely a few chucks right here, so this is all protected in case there's any kind of spillage at all, and then the patient will have the blanket over to keep them nice and comfortable. Okay, that's it on the setup.